Hello everybody, welcome back. Alright, so if this is your first time watching, thank you for watching. Please don't forget to like and subscribe. Everyone, don't forget to like and subscribe. Alright, so this video is going to be about working night shift. My what I do working night shift, every hour, every minute. So I'm going to talk to you guys about it. As you guys know, I'm on orientation and it's going to be over within a week. I'm excited, nervous, but I feel prepared. So let's get started. So it's 7 o'clock, get a report. So usually we do report at bedside. So you go in the patient room and do your report. And once you're in there, usually I will update my patient board with my name, the charge nurse name, if the patient is in pain, put the pain scales and the time, and also make sure the right doctor is on the patient board as well. And if you have any plans, so go put that there as well. So update your board, and then you go back after you get your report, go back to the nursing station, read more about your patient, try to see what is going on, because sometimes you may not get everything in report. So just to cover yourself up, just go back and read your patient chart, because you have from like 7 to about 8 to, before you can give your medication. So once I do all that, I'll go back in the patient room and do my assessment. So assess your patient from head to toe, make sure you do your assessment very well, and if it's a focus assessment, you do that as well. So before you give your medication, make sure you delegate. Delegation is very important because you don't want to wear yourself down. So make sure you tell your PCT what patient blood sugar needs to be done. Alright, any critical things that need to be done for your patient, you have to do it. So it's about like 8 o'clock. Let's say now it's like 8 o'clock. You already did your assessment, update your board. It's time to give your medication. So before I give medication, I will go into the medication room. I usually grab a Ziploc bag because I don't want to have any medication error. Give the wrong patient the wrong medication, which it shouldn't happen because of Epic, but sometimes you just never know. So I grab a Ziploc bag, write the patient room number on there, and put each medication inside the proper Ziploc bag. And one thing I also do to avoid going back and forth, I put each supply in each Ziploc bag. Let's say, for example, my patient is getting some pills, so I make sure I have the cup in there. If the medications have a pill cutter. If they're getting heparin, have an alcohol wipe. If they're having some IV and it needs to be hung, make sure you have your primary or secondary tubing, and also have the label to label the tubes so the next nurse can know when it needs to be changed. So just little stuff like that. So that's what I do. So once I go in my patient room, of course you have to introduce yourself again, let them know who you are. Before you give your medication, always tell your patient what medication you are giving them and what the medication are for, because they will ask you. Trust me, they will ask you. And even if the patient is confused or you feel like they can't hear you, just still do it, because you just never know what these patients have going on. So just always tell your patient what you are giving them and what is it for. If not, they will ask you anyways. And if you don't know, just be like, 1 second, just look it up on the computer and just let them know, because they can't even see your computer anyways. So yeah. So once you give your medication, make sure your patient have their call light within reach, the bed is in the lowest position, and if they need anything, you get it for them as well. And if they don't know how to use the call light, that's a great time to do patient teaching, so you can tell them how to use it if they need help. So let's say usually take about 8 to 10 or 11 or longer to pass out your medication. If not, keep going. So after that, you have to do documentation, and that takes forever. So after passing out your medication, you have to do documentation. Sometimes documentation may take you forever, because as you documenting, your patient is pressing that call light. They need this, they need pain medication, they need sleeping medication, they need all type of stuff. And if you're too busy documenting, or if you feel like you're behind, Again, delegation. The PCT can help you out. They can give them the coffee or whatever they need, but medication. So remember to delegate. So some things that we delegate: assessment, patient education, care plan, daily care and safety, just all the stuff that you do. And if you are in the patient room and you forgot to write down the time that you did their assessment and stuff, what I do the time I go in the patient room to give the medication, just refer back to that time, and you can use that as well to help you chart the right time you were in the patient room. So let's say it's about 1 o'clock now, so make sure you get your lunch in, okay? Don't want you passing out on your patient. Okay, it can happen. Don't overwhelm yourself. So about 1 o'clock, do your lunch. Lunch is about 30 minutes, but you know you work night shift, so lunchtime it is what it is. So get your lunch in, and then you can go back and finish your documentation as well. I'm saying you're back from lunch and you're trying to finish up documentation, so it's about like 2 to 4. So between 2 and 4 is your downtime. Your patient is sleeping. You got some free time to, you know, catch up on things that you need to catch up on. So make sure you get it in. So read more about your patient, update your hand-off report, and make sure everything is up to date. And let's say it's 5 o'clock, so you got to give your last 5 to 6 o'clock medication. So give your medication and then be ready to give report to the next nurse, and then at 7 o'clock it's time to go home. But usually you never leave by 7 o'clock because report take longer. Okay, you may be the earliest to leave at 7:15. Latest will be 7:30 or more, depending on who you're giving report to. They may ask you a lot of questions, or some nurses will just be like, okay, give me a report and get going. So it just depends on who you're giving report to. So that's about it. Okay, thank you for watching. Don't forget to like, subscribe, and share the video. Leave any comments. If you have any questions, let me know. And stay tuned for the next video, which I'll be talking about my experience working day shift. Thank you, and you guys have a blessed week or day.